If you missed the first video dealing with the roots of schizophrenia, be sure to watch it, maybe before even watching this one. In that video, I touched on the recovery rates for people who never used antipsychotic drugs, and we also learned that today's antipsychotics only treat what are called positive symptoms and do nothing for negative or cognitive symptoms, although atypical antipsychotics are said to improve several domains of cognitive function, especially working memory, executive function, and attention. In psychotic patients, they come with serious side effects. Are there ways to reduce those? Take These Broken Wings is a documentary I recommend for everybody who's seeking to recover from schizophrenia without antipsychotic drugs. It tells the story of two long-term patients, Joanne Greenberg, who's the author of the bestseller I Never Promised You a Rose Garden, and Catherine Penny. Both eventually got off the drugs and recovered completely, thanks to years of work with skillful and dedicated psychotherapists. It also exposes prevailing misconceptions about the disorder. For example, staying on antipsychotic drugs for life is mandatory, and it's an illness nobody gets well from. You can find it on YouTube and, of course, in the database. The story of Catherine Perry's recovery can be found in Dr. Dorman's book, Dante's Cure. So anyway, let's dive into some of the studies on natural agents and various treatments known to help, including helping those who are using antipsychotics. So let's start by taking a look at some of the therapies that are helping. Treatments such as cognitive behavioral therapy and vocational intervention are beginning to show statistically significant positive outcomes, often with far more positive and longer-lasting results than traditional antipsychotic regimens. Back in 2012, Mary Barber called for the realization of a standardized recovery model as the final treatment paradigm for schizophrenia. She cited a number of cases where recovery was achieved in completely drug-free patients. Now, it's not a magic bullet, but the efficacy of psychologically and socially guided treatments does speak to the complex and global nature of this disorder. The dopamine hypothesis just isn't enough. Dr. Loren Mosher was the first chief of the Center for Studies of Schizophrenia at the National Institute of Mental Health. He founded the Schizophrenia Bulletin, and for 10 years he was its editor-in-chief. He led something called the Soteria Project, and the research they did demonstrated there's a better way to treat schizophrenia and other psychoses that destroy the lives of so many young people. The Soteria research showed that the prevalent, excessive, destructive psychiatric drugging of all of these young people is a huge, tragic mistake. However, the psychiatric establishment was offended. Prestige and money won, truth and love were lost. By the way, one of the psychiatrists trained in Soteria tells us that with his patients, he's found a couple of dietary supplements that have been very helpful and improved symptoms dramatically. Those are sarcosine and L-theanine. We'll get into those more later. The positive effects are that L-theanine was effective in ameliorating positive symptoms and sleep quality, while sarcosine reduced the general symptoms of schizophrenia. Avatar therapy is helping people stand up to schizophrenic voices by giving them a face. Confronting an avatar on a computer screen helped patients hearing voices to cope better with those hallucinations. This was a trial that was done in the UK. Patients who received the therapy became less distressed and heard the voices less often compared with those who just had counseling. This could be an important new approach to treating schizophrenic hallucinations. Over the last 50 years, antipsychotic drugs have primarily targeted the dopamine system, but between 60% and 80% of the total brain metabolic activity is utilized by what are called glutamatergic neurons. and there's evidence for glutamate abnormalities in schizophrenia. This supports development of novel antipsychotic agents that target this system. Hypofunction of what are called the NMDA receptors appears to play a role in positive, negative, and cognitive symptoms of schizophrenia. And for this reason, NMDA modulators have become attractive as therapeutic targets for all three schizophrenic symptom clusters. So far, some of the agents that are showing promise in research include sodium nitroprusside, sodium benzoate, and memantine. Increased pro-inflammatory markers have been found in the blood and cerebrospinal fluid of patients with schizophrenia compared to healthy controls. So given the role of inflammation in schizophrenia, anti-inflammatory agents could be very helpful. And so here we could take a look at having patients on an anti-inflammatory diet. And as you see here, we have many anti-inflammatory herbs. Schizophrenia is also associated with vitamin deficiencies, both during prenatal development and after illness onset, and this suggests a potential for vitamin supplementation. Some of the vitamin supplements that have been helping folks include B vitamins. They're involved in cellular metabolic processes and oxidation reactions. Folks with schizophrenia often have a low vitamin B level. 2 B vitamins, folate and vitamin B12, are particularly promising interventions in patients with genotypes for common functional variants in the folate pathway. That's MTHFR, and you can look that up here in the database to learn more about it. A review of worldwide studies found that on treatment with high-dose B vitamins, including B6, B8, and B12, there can be a significant reduction of symptoms of schizophrenia, more than with standard treatments alone. The research on the effect of vitamin and mineral supplements on symptoms of schizophrenia was funded by the Medical Research Council and University of Manchester. It's published in Psychological Medicine, one of the world's leading psychology journals. One of the lead authors of a study, Joseph Firth, based at the university's Division of Psychology and Mental Health, said, looking at all of the data from clinical trials of vitamin and mineral supplements for schizophrenia to date, we can see that B vitamins effectively improve outcomes for some patients. This could be an important advance given that new treatments for this condition are so desperately needed. B vitamin interventions which used higher dosages or combined several vitamins were consistently effective for reducing psychiatric symptoms. However, those which used low doses were ineffective. Also, the available evidence suggests that B vitamin supplements may be most beneficial when implemented early. Firth added that there's some indication that these overall effects subgroups of patients who have relevant genetic or dietary nutritional deficiencies. A co-author on the study, Jerome Saris, who is Professor of Integrative Mental Health at Western Sydney University, added, this builds on existing evidence of other food-derived supplements, such as certain amino acids that have been beneficial for people with schizophrenia. These new findings also fit with our latest research examining how multi-nutrient treatments can reduce depression and other disorders. The research team, of course, says more studies are needed to discover just how these nutrients act on the brain to improve mental health. Vitamin D deficiency has been reported in patients with schizophrenia too. Although trials examining vitamin D supplementation have shown variable results, some of the studies demonstrated that early supplementation with vitamin D decreases the risk of developing schizophrenia by as much as 77%. But to date, there haven't been any randomized controlled trials to examine it specifically in patients with schizophrenia. And then there's vitamin C and E. These are antioxidants that remove cellular reactive oxygen species and protect cells from oxidative stress. Low levels of both vitamins have been associated with schizophrenia. There have been some small studies that found that vitamin C decreases serum malondialdehyde, which is a measure of antioxidant levels, which in turn yields improvements in certain scores for schizophrenia. However, vitamin C can interact with anti-psychotic medications, and at high doses, vitamin E can become pro-oxidant and actually increase oxidative stress. So you have to be careful with that. Omega-3 fatty acids are polyunsaturated fatty acids that are necessary for maintaining the structure and function of cell membranes and synthesizing other biological compounds that are necessary for neural function. Also, omega-3s have anti-inflammatory properties. Reduced levels of omega-3s have been found in patients with schizophrenia. There have been a lot of studies showing that supplementation with omega-3 fatty acids does improve schizophrenia symptoms, including what are called extrapyramidal symptoms associated with using antipsychotics. However, it can't be used as a monotherapy in a chronic illness population. It has demonstrated effectiveness in preventing relapse, even in ultra-high-risk patients. Omega-3s have become somewhat controversial. I'd suggest you get into the database and dig into it for yourselves. One of the things that's suggested these days is that if you're going to take a supplement, that you use a plant-based supplement instead of fish oils. Those are generally found from algae sources. Immune dysregulation has also been observed in schizophrenia. It alters tryptophan metabolism. There's some preclinical evidence showing that immune, inflammatory, and oxidative pathways are involved, and that targeting those pathways could be another valid treatment option for schizophrenia. One of the substances they've been experimenting with is the use of melatonin. As an herbalist, I'm curious about whether some of our wonderful immunomodulating herbs could play a role here. Earlier I mentioned the use of amino acids. One of them is glycine, and this has shown some mixed results. However, modulation with simple amino acids like glycine is generating interest among psychiatrists. Another area where more research is needed. Glycine is an amino acid that mimics NMDA mentioned earlier. It's found in the protein of all living things. The normal human diet results in an intake of about 2 grams of glycine daily, and it's thought that supplementing with it may not only have an antispastic activity, but it could have an antipsychotic activity along with antioxidant and anti-inflammatory properties. So there have been a number of small randomized controlled trials looking at the effect of adding glycine to atypical antipsychotics and the impact that would have on symptoms. In 2005, a team of Finnish researchers published a meta-analysis in Schizophrenia Research. A meta-analysis, of course, is something that combines the results from all studies and reanalyzes the data. It has the advantage of increasing the sample size by combining studies. In this case, there were 18 short-term trials included, involving 343 patients who were given various NMDA agonist compounds. An agonist is something that turns it on, you could say. In addition to their antipsychotics. They found that both glycine and another amino acid called D-serine, synthesized in the body from glycine, were effective in reducing negative symptoms, but the magnitude of the effect was small. So they're continuing to study this to try to figure out mainly what the right dose is. It appears high-dose glycine added to certain antipsychotics was helpful. An example in one of these small studies that was looked at, there were 17 patients on either olanzapine or risperidone. They were given 8 grams a day of glycine in addition to their regular medications for a 6-week period, and then the patients were switched. If they were getting a placebo during the first 6 weeks, they received glycine in the second phase and vice versa. The trial was blind so that neither the researchers or the patients knew what was being taken. Anyway, it was found that glycine was well tolerated by the patients, and there was a significant reduction in negative symptoms. The size of the sample, however, was small, and the length of the study was short, but the researchers still concluded that the efficacy of risperidone and olanzapine might be augmented using high-dose adjuvant glycine treatment. In another study conducted by the same team, they used D-serine as the add-on with the same 2 drugs as the previous research. They found there were significant improvements in negative, positive, cognitive, and depression symptoms. While glycine and D-serine both act as NMDA agonists, there are differences between them. Glycine passes the blood-brain barrier with greater difficulty, so more of it has to be taken for it to reach the brain than D-serine, but D-serine's been found to cause kidney damage in animal studies, so until its safety is determined, it's not approved for clinical use in the United States. Now here's a caution. If anyone does wish to try glycine, it's highly recommended that it only be done in consultation with the doctor, and that the glycine used is made to either prescription or pharmaceutical grade standards. Clinical trials have begun with 15 grams a day, and the dose is then increased by 15 grams a day every 3 days until the total dose of 60 grams a day has been achieved. And that's based upon the average weight for the individual of about 150 pounds. It's not recommended that you try this if you're on clozapine. Now, it's possible to increase the synaptic availability of glycine by inhibiting its reuptake through a compound called the Glycine Transporter. Sarcosine is a natural amino acid that appears to have those properties, and in one study, this hypothesis was successfully tested. It was a double-blind, randomized controlled trial on 36 patients with schizophrenia who were being treated with antipsychotics. They were assigned to receive either 2 grams a day of sarcosine or placebo. Sarcosine outperformed the placebo. So far, studies are indicating that sarcosine may be more efficacious, more useful than NMDA glycine site agonists for the adjuvant treatment of schizophrenia, at least in the acute phase. A friend of mine with schizophrenia who's been on antipsychotic drugs for over 25 years told me that what's helped him the most are diet and exercise. Now, mind-body exercise could be especially useful. For example, there was a study done on yoga where 30 chronic schizophrenic patients were selected. 15 of them were randomly assigned the yoga therapy along with pharmacotherapy. They were the experimental group. And the other 15 were assigned to pharmacotherapy alone. The yoga group attended yoga therapy every day for 1.5 hours, including motivational and feedback sessions. At the end of 1 month, a post-assessment was done, and the patients in the yoga intervention showed much better ratings than those on drugs alone. The conclusion was that yoga therapy, along with other pharmacological management and other psychosocial interventions, could result in better quality of life. Now, going back to diet, we saw how an anti-inflammatory diet could help. Some people may also need to be on a gluten-free diet. Now, not everybody's sensitive to gluten, but there's evidence that those who are and are schizophrenic benefit from the gluten-free diet. Some of the people who think they're sensitive to gluten may actually be sensitive to something else called FODMAPs. FODMAPs are a collection of short-chain carbohydrates and sugar alcohols found in foods, including wheat, or as food additives. FODMAPs include fructose, when there's more of it than there is glucose, fructans, galacto-oligosaccharides, lactose, and polyols like sorbitol and mannitol. In this case, a low FODMAP diet could be more appropriate than a gluten-free diet. And there's another kind of diet that's been shown to benefit schizophrenia, and that is a low methionine diet with the addition of suggested vitamins and minerals like B12, folate, B6, niacin, zinc, and manganese. Excess copper should be avoided by everyone. While the use of cannabis has been implicated as a risk factor for developing schizophrenia, recent research tells us that this is limited to those who already have a genetic predisposition. The urgent need to develop mechanistically different anti-psychotic compounds that are less side effect prone has turned researchers towards the endocannabinoid system. It's been suggested to represent a potentially new target. One of the cannabinoids they're exploring is cannabidiol. Results from animal studies are inconsistent to a certain extent. They seem to depend on behavioral paradigms, the treatment design, and experimental conditions. It has shown anti-psychotic properties in animals. The first randomized double-blind clinical trial demonstrated that in acute schizophrenia, cannabidiol exerts anti-psychotic properties comparable to the antipsychotic drug amisulpride, while being accompanied by superior placebo-like side effect profiles. It increases levels of anandamide, one of our natural cannabinoids that our bodies make, and it's this anandamide that's reducing psychotic symptoms. Oxidative stress plays a role in the pathophysiology of schizophrenia. Oxidative damage can kick off a large range of cognitive defects. In research focusing on antioxidants to counteract this, L-carnitine was tested, for example, and while it did improve some domains of cognitive function, there were too many adverse effects. Better results were shown in the use of sulforaphane, an organosulfur compound, which happens to be very high in broccoli sprouts. It's a potent antioxidant and anti-inflammatory. A small trial using broccoli sprout sulforaphane measured serum levels of brain-derived neurotropic factor, BDNF, at baseline, and after taking broccoli sprout sulforaphane for 8 weeks. BDNF shows neurotrophic activity against oxidative stress, which may improve cognitive defects. When you go to the database and look up broccoli sprouts, you'll see that their side effect profile includes wide-ranging improvements in overall health. We do have to be careful with antioxidants because overuse can actually backfire. Check out the antioxidant section in the database. Meanwhile, broccoli sprouts seem like a pretty safe bet. From Ayurveda, we have a botanical neurotropic called Bacopa. It's been the focus of a lot of research into how it protects the brain. In the database, you'll find a study suggesting Bacopa could be a new frontier for restoration and prevention of cognitive defects in schizophrenia. One of its actions is to increase BDNF levels. As always, check out the cautions, and the main one here is that some Ayurvedic herbs have been found to carry a lot of heavy metals, so we have to be careful about the source. I've included reputable sources for Ayurvedic herbs. Experiences from China suggest that some traditional Chinese medicine approaches can have an antipsychotic effect while causing fewer side effects. For example, Wendang decoction is one of the classical traditional Chinese prescriptions for severe mental illness, such as schizophrenia. In February of 2016, the information specialists of the Cochrane Schizophrenia Group ran an electronic search for trials that randomized people with schizophrenia to receive either Wendang decoction, a placebo, no treatment, or antipsychotic drugs. They screened all the records found in the search and included those that met that inclusion criteria and reported useful data. 15 trials provided useful but limited data, and the results showed that this decoction could have some beneficial effects on short-term global outcomes and the mental state of people with schizophrenia as compared to placebo or no treatment. The results of this review suggested that it could be helpful for people with schizophrenia, but the results are based on low to moderate evidence, and there just isn't enough high-quality evidence to make any firm conclusions. So they're calling for better designed large studies to fully and fairly test the effects of Wendong. Homeopathy also offers assistance. Recommendations are based on differentiating between different symptom pictures. For example, where there's a high degree of suspiciousness, Lachesis is recommended, Lachesis muta. It's really good for paranoid delusions. For someone with auditory hallucinations, Anacardium orientale is used. If someone suffers from the delusion of being poisoned, Hyoscyamus niger is considered useful. Barytocarb is recommended for people who have a high suspicion that people are talking about them. And so here you can go through other recommendations, and if you question the effectiveness of homeopathy, I suggest you visit the database and look at all of the research that does appear to confirm its effectiveness. Among the serious side effects of antipsychotic drugs is tardive dyskinesia. Symptoms include things like facial grimacing, finger movement, jaw swinging, repetitive chewing, and tongue thrusting. Now, a meta-analysis of 3 trials done by Chinese researchers found that ginkgo biloba improved these symptoms in schizophrenia. Treatment with 240 milligrams a day of ginkgo improved symptoms of tardive dyskinesia and raised BDNF levels. Be sure to take a look at the cautions section for ginkgo, because there really are quite a few of them. For example, it can be toxic in large amounts. Consult with your health professional before using it. It interacts with things like aspirin and warfarin. It can cause bleeding. It does have a blood thinning effect, so you really want to be careful taking it with any anticoagulants or antiplatelet agents. It can increase the action of monoamine oxidase inhibitors if taken at the same time. Now that's just theoretical. And it can decrease the anticonvulsant effect of anticonvulsants. So just don't take it at the same time. It can interact with acetaminophen to increase the risk of bleeding. And there's some thinking that maybe it could interact with garlic, phosphatidylserine, polycosanol, and vitamin E. That's not for sure, but it's a possibility. I hope all of this research helps you and sheds some light on what can be done towards recovery and improving life quality. Of course, this is really just the beginning, because research continues, and as I find more evidence to support other therapies for schizophrenia, I'll be adding it to the database. The next video is going to be on how to get off of antipsychotic drugs. Thank you for joining me, and please do sign up for the database, join our Facebook group, Herbal Knowledge Keepers, and subscribe to the channel.